A question I often get asked by transgender guys wanting to undergo top surgery is, do I weigh too much for surgery? So in order to answer that question, first of all, we need to know what your BMI is. So BMI is your body mass index, and we just need to know what your height is in addition to your weight. If you don't know what this is, this number is very easy to calculate. What you can do is just Google BMI. There are lots of calculators on there. You just put the numbers in and figure it out. So a BMI of 25 and above is considered overweight. Once you get over 30, that's considered obese. And above this, risk of surgery really do begin to increase. However, I don't necessarily have a strict cutoff within reason, and this is because I strongly believe in patient-centered care. So every time I meet a patient, I'm going to want to know what the patient's other medical problems are and what problems they're having without top surgery. So for example, in some very large guys who are carrying around very large breasts, sometimes what we'll see is they are suffering from significant dysphoria, and in addition to that they have some other health problems from the large breasts, such as rashes underneath, such as neck pain, back pain, shoulder pain. So in that patient, for example, the benefits of doing the surgery may outweigh the risks of the anesthesia when they're still overweight. So in Indianapolis, we do have a lot of experience in offering gender-confirming top surgery or masculoplasty to overweight guys. And so in fact, when you look at our numbers, our average BMI patient is actually 31.5. So I feel that we can offer it safely. However, if you are a larger guy, there are some things you need to know that you are at increased risk for. So first of all, patients who are overweight oftentimes tend to be diabetic as well, and this may put you at increased risk of wound infections. So we see in our overweight patients about a 5% risk of a wound infection. This is usually pretty easily treated with antibiotics and tends not to have any long-term consequences. The next thing to remember is if you are seeking top surgery and are overweight, we oftentimes will advise that you're admitted. The reason for this is many overweight guys will have sleep apnea even if it's not diagnosed, and sometimes they'll hold on to that anesthetic and be pretty slow to wake up. And so for this reason, we may want to observe you overnight. The final thing to remember, of course, is about your result from top surgery. So operating on larger guys, there is a finesse to it, and it is a little bit more difficult for your surgeon in that the risk of dog ears do increase. So what are dog ears? These are when you have those lumps of tissue on either side. Patients who are at risk for this are patients who their anatomy wraps around the back. If you're lying on your back at the initial surgery, obviously it's going to be difficult to fully treat this, and sometimes that patient may need to come back for another surgery in the future. However, I always really try and extend out those excisions and hopefully get a home run at the first surgery. So the last thing to remember in patients who are overweight is that oftentimes we won't do a double incision. So meaning we will do a masculoplasty or double incision, but make the incisions meet in the middle. And the reason we have to do this is oftentimes if we keep the incisions separate, you may be left with a lump of tissue in the middle, and this can look very unnatural and never really gets better by itself. So for this reason, and I'll usually be able to tell you beforehand, you will be warned, sometimes we do advise bringing that incision across the midline. So those are just some considerations for our larger patients. Like I said, strongly believe in a patient-centered approach. So every patient is on a case-by-case basis. Sometimes patients are advised to lose a little bit of weight, or sometimes even a lot of weight, in order to safely undergo the surgery. But overall, if you are a little bit overweight, it is certainly safe to offer gender-confirming top surgery. So I hope this answers this question.